Good morning, and thank you so much for joining us, Jackie.
Thank you so much for having me, Rebecca.
Yeah, and I will tell you, getting to talk to parents is actually one of my favorite. No offense to all of our medical people that come on, but I love the parent experiences that we get to talk about because y'all are there, y'all are in the trenches, you're the ones dealing with this day in and day out. So before we get started, I just want to personally say thank you for coming on and sharing because I know it's kind of scary and it's not always the easiest experience to share. So thank you.
You're very welcome. Very welcome. And you're,
Absolutely.
yeah, hitting it, perfectly because it is also emotionally to share this, right, with your
Hmm.
child and yourself and your husband. So yeah.
Yeah. Yeah. Well, I guess we're going to start from the beginning.
Yeah.
And first of all, so that I contain myself when you say it, shout out to my hometown. Yeah, Houston, because that's where you are.
Yeah.
Um, So let's just go ahead and start from the beginning. How did you find out that your daughter was dealing with this? And then, as it happens in many families,
Mm.
to you and your husband?
Yeah. It's a really good place to start the conversation, I think,
Mhm.
because it was not easy to find out. Um,
Right.
because as you know, so many symptoms related to an airway disorder are easily missed or
Hmm.
misunderstood.
Right.
Going back to when Laura was born, there was nothing directly indicating that she was suffering from this. She was born, around her due date, and I was able to breastfeed her actually exclusively until she was 6 months old. Um, yes, she was a bit gassy. Her sleep was, not perfect, but that's normal. What do you
Right.
expect?
It's what you think. Yeah, it's what you would expect. Sure.
Yeah. So, and she was also gaining weight. So the gassiness, we were being told, let's wait and see, usually it resolves later on, and it did.
Mhm.
So it was really around, I would say, when Laura was about 1.5 years of age, old. She started in daycare setting,
Okay.
and when she started there, she started to get sick a lot. She
Mm.
had upper respiratory infection back to back. It was like we were never getting a break from it.
Mm.
And soon or pretty quickly, those infections they turned into an ear infection. And again, that was not unusual because you hear this
Hmm.
a lot that a lot of children are
It's
suffering.
normal. Yeah.
Yes. Um, Unfortunately, she had an infection, and the antibiotics she was giving gave her an allergic reaction. So since she didn't resolve from that infection by herself, the ENT was pretty quickly, I would say, to suggest that she should have ear tubes.
Mm.
So she had that around, I believe she was around 20 months old.
Okay.
And her sleep, of course, was also not perfect. She was still waking up. But again, you're being told
This
this
is
is normal.
normal.
Yeah,
Right.
yeah. So she had the ear tubes, and she continued to being sick, um, very often, and even having trouble with the ears, even though despite she had the ear tubes.
Hmm.
Um, and so yeah, this was when she was about from 1.5 years of age and then to 2 years of age.
Okay.
And it just continued. And after a round of group that where we ended up at the ER, I remember saying to the ER physician, she's really sick a lot. And even the ER physician told us, this is common or normal, I would rather
Mm.
say, he said. And I was getting worried because her breathing, it was never just like a runny nose. She was really sick. It took
Hmm.
a week or maybe 2 weeks with high fevers and bad cough. And even that itself affects the sleep, right?
Right. Sure.
And it became more and more clear to us, oh, she would really benefit from more sleep, better sleep, because
Hmm.
according to what is suggested as appropriate amount of sleep, we were there, but she was still waking up.
Right.
And
So it wasn't that quality sleep that she
oh,
needs. Yeah.
yeah. And since she was waking up so frequently, we decided to take her back to our bedroom because we were exhausted, my husband and I,
Sure.
from
Right.
running back and forth
Hmm.
between bedrooms. And then with her crib next to my side of our bed, I started to notice her breathing. It was not severe at that time, I would say. It definitely increased in severity later on, but
Hmm.
she was breathing heavily, not all night. And some nights were probably better than others, but I started to be worried. And I started to address this with the ENT and asked him, what about the adenoids and tonsils? Because
Mm-hmm.
I do have the educational background as a nurse, so I was, there might be something here. But he was still a little, I would call it hesitant. He still said, oh, she's still young, so let's wait.
Mm.
And having that for some time, that approach, I was just, no, I can't wait more. There's something. And even
Yeah.
the pediatrician started to talk about maybe there's some asthma going on. Um, so I decided together with my husband that we wanted to go for a second opinion to have at least a better evaluation of the adenoids and tonsils because we didn't have that with that ENT. And the
And you
new,
knew something was there. You were going with that mama bear gut.
exactly. And
Yeah.
I just, that thing about wait and see was just,
Wait and see.
and it was also, Laura was getting, she used to be a happy child. But she was
Mm.
irritable even in the morning. And
Yeah.
then it usually helped to have breakfast because knowing now breakfast is giving you energy, right? So that will help a little bit and she would cheer up. But yeah, then we had the second opinion with a new ENT. And he, of course, went through her medical history and could see how many rounds of antibiotics she had had.
Hmm.
And listening to the symptoms we were describing, mouth breathing, snoring, and irritable. And he said this is typical for a child who is not able to breathe and therefore sleep well.
Wow.
Yeah.
That
And
just, I'm sorry, but that does my heart good that somebody, thinks and sees in that way.
yeah, so he actually suggested pretty quickly, I would say, that we should go for the surgery. Also, due to her age at that time, she was just about to be 2.5.
Hmm.
Um, and sleeping and breathing well is critical
It's
for
critical,
everybody
right?
for your development. So we were waiting. I think there was about 2 months wait time for that surgery, and during that time, we had her dental appointment coming up,
Hmm.
just a regular checkup. And her pediatric dentist, I told him about what was going to happen. And I'm sure he could already tell just from looking at me that I looked like an exhausted, tired mom from
Hmm.
not just the fragmented sleep that was also affecting us, but also emotionally
The
to
emotional, yeah.
have this child that when you go out seems happy and very active. Uh,
Hmm.
but as soon as she came home, she was just, loosening it. And she was
Mm.
meltdowns and it was so hard to watch and be a part of.
Oh, of course.
Yeah, so he even, that dentist told me, oh, he had seen that, he had seen other kids having that surgery and that was helping them a lot. And he also told me that while we were having the evaluation with him or the appointment, he said, I do see that Laura has a lip tie. And that was new to me. I didn't know, to be honest, anything about lip ties. I had barely heard about tongue ties at that time.
Mm-hmm.
And it was never on my radar when Laura was an infant because I was able to breastfeed her and I
Without
continued
any issues.
until she was 13
Yeah.
months. But he said it's not a big issue. It's more like a matter of hygiene. It could potentially be causing issues. But he would suggest that it was being released by the ENT since she was put under general anesthesia during that surgery to minimize
Okay.
discomfort. And I said, would you make a referral letter to the ENT because so he knows where this is coming
Yeah.
from and all that. And it was
Yeah.
also new to me as well. And he did so. And on the day of surgery with the ENT doctor asked me why I wanted this procedure added. And I said, it is from her dentist who recommends this. And ENT disagreed and said he didn't find it severe. And he would look at it, but it was not something he was likely probably to do, he said. And I said, sure, no worries. You're the doctor.
Right. Right.
I trust your decision. So Laura had the tonsils and the adenoids surgery. And within that month, during the recovery, we started to see progress in her sleep and breathing. She was not snoring as much. But I was still concerned about her mouth breathing because that was still there. So I addressed that during the 1 month follow-up. And the ENT said, let's wait and see. We'll have a follow-up in 6 months. And you're already seeing some improvements. So let's see. And it was just after, I would say, even within a few months after that surgery, we started to see the symptoms coming back. Snoring started to happen. She was sweating excessively during sleep. Like, we live in Houston, so we have AC available. So
Right.
it's not like it's hot. We're actually cooling down the house a lot for nighttime. So that was not the reason for her to sweat. And then we had a vacation in our home country, Denmark, where we were together with Laura's cousin, who is at the same age. And it was just so clear when those two kids were waking up in the mornings, there was such a difference, in the behavior and the ability to go through the day.
Right.
And we came back to Houston after that summer, and I said to my husband, there's something, And then it reminded me of that lip tie. So I started to look into that, and I found a local provider here in Houston who is highly qualified in doing those procedures. So I signed up for a consultation there, and there was again some wait time. So now we are in 2022, just before Laura turned 3.
Okay.
And then we had the evaluation, and she actually showed up with a severe lip tie and what they then called a posterior tongue tie. And I was just like, tongue tie, what
Just
is this?
been missed. Yeah.
Yeah, and I didn't know what that meant actually. But they explained to me that it's not just a snip, or we will just not just use the laser. You need to go through, due to her age, we need to start therapy with a speech language pathologist with myofunctional training.
Yeah.
And just that word myofunctional, I was like, what? What is that?
What is that? Right.
I'd never heard about it. So I came back that day from the appointment, and I started searching myofunctional therapy, looked that up. What is it? And I found a podcast with myofunctional therapist Brittny Murphy. And the first episode I listened to was the one with Dr. Shereen Lim.
Yeah.
And everything in that interview or podcast was just spot on and
Was
giving
Laura.
me so many answers
Mm-hmm.
what was happening or what had happened here. And it was not just about tongue tie and lip tie. It was actually a matter of how her jaws are growing.
Mm-hmm.
And yeah, I've never been able to look back since then. And now she had today Laura is 4 years old, and she had her tongue and lip tie released successfully. She's been doing myofunctional therapy, and she's now in starting to have her expanders, an upper and lower expander with
Mm-hmm.
a provider.
And she's sleeping and
This, I would say, we already we had one expander in. Unfortunately, that broke.
oh,
But
okay.
yeah, so that was a bummer, but that can happen, unfortunately, right?
Yeah.
But what I want to point out is really when we were doing the expansion with that expander, after about 4 weeks by turning actively, we
Mm-hmm.
started to see an amazing improvement in all her symptoms. And when I really think some of the symptoms are important to mention, because symptoms like bedwetting,
Mm-hmm.
Laura has not been using it. She's been able to use the bathroom since she was 2.5 years old during daytime, but we had never seen any dry pull-ups during nighttime.
Mm-hmm.
And it hasn't been a concern due to her age. It's usually after
Right.
5 you would be concerned.
Right.
Just knowing about this, I was just curious to see what's going to happen when we start expansion.
Sure.
So that improved, and she was able to sleep on her back. Normally, she would always be on her stomach, and she would normally toss and turn in bed,
Mm-hmm.
waking up, of course. And her mood, her energy during day that's the most incredible change, or that was the most incredible change, to see how she was going through her day, getting the sleep she needed. And how we found out that the expander was defective was the symptoms came back.
Oh.
The expander was kind of like going backwards. So it was
Got it.
but that's how sensitive they are, these kids. We are talking about millimeters in expanding
Yes.
the nasal cavity, but how much that improves their symptoms. And it's
Yeah.
also symptoms like related to getting dressed, having sensory issues
Mm-hmm.
gone while
Right.
she was able to sleep well.
I have these part of what makes these podcasts my favorite is when you start to hear the progress and this improvement, and it's really hard as a mom not to cry,
Yeah,
because this is a child that's helped. She's not going to end up like me or like Savvy or like all these other people running around with Airway that we didn't know.
yeah,
Such a different lease on life now she has, and that's why we're here, and that's what it's about, and that is amazing.
yeah.
And how does that impact you and your husband now?
It's hard to find words. And it's we are so thankful that we found out, because we were thinking what else is going on with our child.
Mm-hmm.
Even though I really feel I feel it's hard to admit that it was the behavior that made me what should I say, curious about what is going on. But it
Mm-hmm.
was because we even I think we all have heard about the terrible twos, the way of the strong
Sure.
kids,
Right.
or the three-nager, and they might have their place. I'm not the one to judge that or decide that, but all I can think of when we have those issues with kids is just have you had them screened? You know, it only takes a pediatric sleep questionnaire to do, and that could be done by the pediatrician easily, in my opinion. And I think that's where there needs to be some changes. And it's not easy, because that's also a part of our journey to really also be honest about finding out about this. You know, it feels like it was on our own, and it shouldn't
Yeah.
be that way.
Yeah. Agreed.
And you trust your doctor, your pediatrician, you trust the ENT when you go there, and it's hard to you know, speak up and say, I'm not sure I agree with you, because I'm not the doctor.
Right.
But I for sure know my child, and I know there's something that triggers this.
And and kind of to that, two things, and we say this all the time. Just like parents, you don't know what you don't know. We didn't know. Our parents didn't know. These doctors and physicians, highly qualified, let me just add, doctors, physicians, dentists, all of them. There is no knock on them. They didn't know. They weren't taught. They were just as let down. So here they are,
Yeah.
giving you what they were taught, what they believe in.
Yes.
And this is part of why we started this Airway Mama Bear movement, because there is something to that your gut instinct as a parent. You may not know what it is, but you know something's wrong.
Yeah.
And we have heard it from guest after guest on here, as moms advocate, and dads. I don't mean to just leave them out, but it's typically the moms, but advocate. If you think something's wrong, kind of like you did, keep asking, get that second opinion. Keep advocating for your child until you figure it out.
Yeah, for sure.
Yeah.
And I also think, that, as you also know, but doing your own research, and I think that's why your podcast as well is such a great resource, because it's providing us with the information, but you need to have access to it. You need to know what to look for.
Right.
So by sharing our story, and hopefully other parents as well sharing their story, that's probably what's going to move this as well, because then we will seek treatment that can help our children, and not just give us a band-aid solution. Like having not saying that tonsils and adenoids doesn't have its place, that surgery.
Because sometimes it does open up the airway, and that's enough.
Yes.
Right.
Yes. Like Laura's case, her adenoids, the ENT described them as huge, so they were causing an obstruction for sure. But it's not just one thing, there's more into it. That's just one piece of the puzzle, just like tongue ties and lip ties.
Yeah.
One piece of the puzzle.
Right. And one solution is not right for every child either. And that's something we have heard time and time again with our guests. You have to look at the child and customize whatever the treatment's going to be to them. But the main goal, and I will quote Dr. Shereen for this over and over, let's get to the root cause. When you get there, then you can make a difference. And stop normalizing. As Dr. Moralia says, normal or common doesn't mean normal.
Exactly.
Back to that terrible twos. No, they don't have to be that terrible.
No.
Sure, there's psychological stuff that goes with it, but man, you throw an Airway with it and you just added a gas to that fire.
Yes. We talk, and the scary thing is right now that behavioral issues, it's increasing at a rate that is
ADHD.
Yeah, exactly. It's so difficult to find a really good explanation, except from let's look for the airways. Let's look how they are developing. And I guess, or I know it can be hard if this is new for someone. because it can seem like too good to be true, that this is actually the cause, and that can affect so many aspects that you wouldn't think is related to the airway. But I will also say, having the background as a nurse, what is the one thing we look for in an acute situation? You triage your patient from A, B, C, D, E, which starts with the airway.
Airway is A. Yep.
And that emphasizes how critical it is to our well-being, our survival. And it makes sense that, since we know it's not something we're making up, that, they can see from the anthropologist that our faces are shrinking, and it's due, and it cannot be explained by the genetics only.
No.
Because it's happening so fast that that's not accurate. But it makes sense that we are not chewing, we have fancy blenders, and we cook our meat so it's tender and juicy and all that. So we barely chew. It just makes sense that's a good explanation,
Yeah.
It's
Yeah.
right
And
in
I'll tell
front of us.
Right. And I'll tell you what, for what it's worth, I mean, obviously, I've experienced this firsthand, and I've been very fortunate to be able to talk to all these different luminaries and just around the world that are working so hard to change this. And then the parents like I've gone back and just even within my family, as many generations as I can that we have photographs of. And these are people, when we go back far enough, the moms were still at home. So she was cooking and we were breastfeeding, and they didn't have a lot of money. So, they were using nothing prepackaged. It was all homemade. And I'm just looking at pictures of my family going, are you kidding me? You can just see enough just from that. So to me, it makes sense. Then when someone like Dr. Boyd comes in with, here's a skull from 300 years ago, I'm going, well, yeah, of course that looks like that, because I can go back 6 or 7 generations and see a difference. So genetics, no. But I do understand how it runs in families, because, kind of to you and your husband, you grew up post-industrial. So of course it impacted you.
Yeah.
So it's not genetics, but it's our surroundings that have done it.
Yeah. And to follow up on that, when we started to learn about this, learning that mouth breathing is not a proper way to breathe, which we didn't know. I know it sounds crazy. I feel embarrassed by being a healthcare professional, and I didn't know. But immediately we looked at my husband, because he's always been mouth breathing during sleep. He's always been sleeping on either his side or his stomach with his neck extended. Right?
To get air. Yeah.
But he's never really been snoring.
Okay.
But he's always been tired in the morning, like cranky. I even remember when we started to live together that I talked with his mom about it. I said, he's so cranky in the morning. And she looked at me and she said, he's always been like that, even when he was a child. And I was like,
again, normal. It's normal.
Oh my God.
It's so normal. Yep.
Here we have an adult. He was that child. Also, ADHD was not a thing, or at least not as common or popular disorder talked about that much when we were.
I have a theory on that, by the way. When we were younger, we were told, be quiet.
Yeah.
Right? You were either just told, be quiet, go over there, or we were always outside. So no one knew if we were acting insane and running around and being,
Well, before
so maybe it was there.
Yeah, a discipline issue. That's why. Oh, they're not having enough discipline. That's why they're acting out.
Yep.
When we started to learn about this, and I remember that sentence from his mom that, oh, he's always been like that. He always needed time, even when he was very, very young. I was just like, oh my God.
Yeah.
And so it didn't take us a long time to kind of start to look at ourselves, because again, it's not like Laura is a unicorn. It's more the opposite. It would be, to find a unicorn who is not having issues.
Exactly.
So it was natural for us to start, okay, what about ourselves? And my husband went for in-lab sleep study with Dr. Jerald Simmons here in Houston.
Yeah, we know Dr. Simmons well.
Yeah, wow. We feel very blessed to be close to him, have that opportunity here. But he
And by
came
the way,
out.
I'll put a link to Dr. Simmons
Yeah,
in the show notes because he has sleep labs. There's 4 in Houston and there's 1 in Austin. So
yeah, yeah. Because not all sleep studies are the
are the
same.
same. Exactly. Yep.
But he actually first had a home study done, which
Okay.
was showing mild sleep apnea. I believe at, basically looking at the AHI. But it was in the mild category. But since he was so symptomatic, we went in for the in-lab study with Dr. Jerald Simmons, and it showed that he has moderate sleep apnea with an AHI of 18, which I think is quite a difference from going from having an AHI of like 5 or 6
Right. It's
to
quite a
8.
jump.
And it's within the same year. So so he's also doing treatment, and we're hoping he's actually a candidate for double jaw surgery. So it's really hard on him as well, and he's
Sure.
so determined that we need to change this for our daughter, because he just thought this was how he was supposed to be. He has a good job. He's been doing well on that front, but now he for the first time he's like, wow, this is me. And also for his situation, I want to mention that when we were in our 20s, we were kind of looking into something with him, because he was always thirsty at night. He was drinking a lot of water. So the first thing we were thinking, oh, is this diabetes?
Right.
Is that what's causing him to be so thirsty and dry mouth in the morning? And he had all his vitamins checked back then, and of course checked for diabetes, and everything came back normal, and there was no concerns. So we kind of just like, okay, there's no explanation to why you
It's
never
just normal for him. Yeah.
yeah. And I also think it, for him, no matter, it was actually getting worse the longer he slept. Let's say he was sleeping 5 hours or 6 hours compared to when he was sleeping 8 hours or 9 hours. He woke up feeling worse with those 8 or 9 hours, which actually makes sense if you think of it, because he's lacking on oxygen for longer time.
He's fighting longer. Yeah.
Yeah. There's just so many answers we have gotten over the last, I would say, 1.5 years.
And you're on your own airway journey, right?
Yeah, it was, again, we had to have ourselves evaluated. And we both went, we have an orthodontist here in Houston, Dr. John Karotkin, who collaborated with Dr. Todd Scheyer on mouthpiece. And I went in for an evaluation together with my husband. And because the thing is, I didn't have like crooked teeth or anything. I've always been told, oh, you have beautiful straight teeth and everything is looking fine. But about 3 years ago, I did have a wisdom tooth extracted by my Danish dentist, because I continued to see her twice a year since we go back there twice a year usually. But this was during the pandemic, so I was starting to a point where, okay, I need to find someone over here. So I had my last appointment with her, and she extracted that wisdom tooth. She did tell me, Jackie, I do see some wear on your upper front teeth. You have a pretty severe deep bite. I think it would be I would suggest braces for you. I said, yeah, I can't do it with you or somebody because I live, in the
Right.
States.
I'm in the States now. Yep.
And then she said, no, it's not urgent either. So it can wait. But just so you know, so when we find out about this, that, you shouldn't just ignore a deep bite and all that. I went in for an evaluation myself, and turns out I also have a pretty narrow palate, or I want to say.
Yeah,
Um,
pad,
yeah, because
because you have a Marpy.
yes, yeah, which is an expander, but with screws. Because
Hmm.
as an adult, you can't just expand like you do in
Right. It's a harder process. And what's that been like as far as just not just the pain, but just the emotional side of that?
I would actually say knowing why I went in for it made a huge difference, because
Mm,
it's a quality of life. It's a matter of that. And the effect of having MARPy is so what should I say? Drastic. You feel
hmm.
so quickly, after the suture splits and you open up the palate and you start to widen it. It's just you can feel the increase of airflow immediately. I don't
Wow.
know what else to, it's so much better. Uh,
Yeah.
but since I still have the appliance inserted, um, it's hopefully coming out in this summer. Um, that's what we're planning for. My tongue is not able to be in the right position because
Because it's
I
there. Yeah.
yeah.
Right.
But airflow is so much better. And now we are of course working on getting back to a good occlusion. So that's a lot of work. But I trust the process, and I'm so happy I went in for it. And
Yeah.
it was really not that bad. Of course, the first week is you have some discomfort.
Sure. Because
After
it's
that,
attached. Yeah.
yeah. Um, but it's eating is probably the worst, but I can live with that. That's only for a limited time, right?
Right. Now, how long have you had it so
I
far?
I had it inserted back in October 2023.
Okay.
Yeah. And
So
then
this is fast. If it's going to be this summer, that's really fast.
yeah. So, it was like a couple of months of active turning the device.
Hmm.
And then you have to, have like a retention phase where the bone grows back in a new place.
Hmm.
So yeah.
I love listening to you talk about this because you clearly have done all of this research because you've got the terms and you know what to say. It's really impressive. I just would
Thank
like to
you.
point that out.
Yeah, I must admit it's really become my passion. And that's also, it's all thanks to all the resources available, because
Hmm.
there is a lot of resources available to us.
Right.
But if you
You have to
don't
know where to
know,
look.
yes, for sure. And that's also the thing right now, what I see, with I'm sure our family back in Denmark, they were thinking we were completely crazy to begin with. Like, that's because they live in America,
Right.
that's where this is coming from. But I will say we've also done a lot to kind of educate them. Um, and the problem is there that, my parents are older, so reading books in English and articles is not that easy for them. But
Gotcha.
James Nestor's book has been translated to Danish.
Hmm.
My mom has read that book, and she's just like, wow. And further, they have seen our daughter. They have seen the changes she had when things are hard and when things are better. And that is like having a different child. So for them, they live far away. So when they are here for like a couple of weeks, maybe 5 weeks. So they really see how it is on a daily basis. And that was also clear to them. There's something that triggers this in her. She's not a bad child.
Right. Seeing is believing. And that's the thing too, right? So many of these kids, I love that you said that. They're not bad kids. They're not misbehaving on purpose. They're little,
Yeah,
they're dealing with it. And it's just this emotional outpour.
yeah,
They're not sleeping. Their brains aren't working the way they're supposed to.
yeah, yeah.
Yeah.
It's
And
really
and it's not a US thing. We have over 400 million kids worldwide right
Exactly.
now. That's just right now. There's a whole new group coming up.
Yes. I
And
even,
then,
I'm in contact with people back in Denmark, and they are so frustrated because there's not any dentist there who can provide a tongue tie release even for a child.
mhm,
They are not allowed, or doing early expansion. You know,
mm,
the earliest you are able is if you are, the very earliest is about 8 years, and they prefer even to wait longer. And it's not in the scope of their practice to look at the airways. It's just a matter of looking at the teeth.
yeah. And as
So
Dr. Boyd would say, 8, 9 years old, that's a geriatric child.
yes,
That's, we must wait fixed before 6. We got to get in there.
yeah, but and I think it's because people don't know, why do we treat early. One thing is because you could have a child that is not that symptomatic, when
Mhm,
they are 3 or 4 years of age, but they might still have issues, that they might be
right.
off track with their growth and development in their jaws. But parents just see the straight teeth and the no spacing, and they think, yes,
That's
they
it. Yep.
have a great smile, but they don't know.
But that's, yeah, exactly. They don't know. That's not what it's about. And I'll tell you, that's why it's so important that we have these luminaries and advocates like Sharon Moore and Dr. Boyd and Dr. JJ and Shereen Lim that are, going to World Sleep Conference that was,
Yes.
it's just in Brazil,
Yeah.
or there's a conference coming up in Australia, and we're all traveling around the globe.
Yeah.
Not because we all want the airline points. We're tired. We're traveling around the globe because people need to know.
Yes.
They just don't know. And there's, you can watch kind of like you talked about, the screenings at birth and tongue tie releases just in Brazil, and you can see the stats. The data didn't lie.
Yeah.
It's making a difference. But
Yeah.
we have to get to them and for them to know first, because if you don't know.
Yeah. And what, as you know, what the pushback is, there's not enough evidence. We need the
Right.
controlled randomized studies to kind of justify what we're doing. But
Control study. Who's going to study on a kid? What kid are we going to say, okay, this kid we're not going to touch, but this one we're going to
exactly,
fix?
yeah.
But that's not going to happen.
Who wants to be the control group there? Nobody.
No, nobody.
And that's also, research done by Dr. Audrey Yoon and, Stanford.
Yes.
It's amazing. That's what we need. So yeah.
I love that. Well, so usually at the end of an episode, I turn it back to the guests so that they can share something with the other parents because they're the experts. And I want to change that a little bit because you are the parent this time. So as a parent, speaking to our parent audience, I would like to leave you with the last word.
I really want to say that you need to open your mind and start learning about this, because otherwise you will easily be missed in this. And the earlier you can help your child, the better. And you know why? Because the phases, the rate it develops at, what should I say, that gives you the answer to why we need to treat early. So going to having resources like your podcast and even your website, that's really where we need to start. Parents need to be aware, and so they can demand this treatment and they can search for this treatment, and so it becomes more accessible for them. Yeah.
Well said. Well said. Thank you so much for coming on, Jackie, and sharing your story. And please keep us updated on you and your husband and Laura.
Thank you so much, Rebecca. Thank you.